Is it true that there is no treatment for mixed connective tissue disorder?
No, absolutely not. You treat the underlying autoimmune disease and it takes care of all of your symptoms throughout your whole body.
Hey, everybody. Today we have an interview with Amy, who is an RN who's been suffering with decades of symptoms dealing with mixed connective tissue disorder, lupus, Sjogren's, hypothyroidism, IBS, and POTS. In fact, career-ending POTS, POTS. What I'd love today is to have her share her journey. She recently just graduated from our program, Transform Autoimmune Disease Naturally. I'd love for you guys to see where she is today, just 2 months later. I'm Maggie, UMD. I am a functional and holistic medicine physician and the creator of Transform and the Transform protocol to turn around any autoimmune disease naturally. If you haven't joined our Facebook group, I'd love for you to click the link above or below this video to join our Facebook group, Transform Autoimmune Disease Naturally. If you're watching us from YouTube, make sure you click subscribe and ring the bell and give us a thumbs up so you get notified every single time we go live. Hey, Amy, why don't you introduce yourself to the audience?
Hi, my name's Amy Fuller. I am a registered nurse, been married to my husband, Brad, for 23 years. Wow. We have 2 sons. They're 22 and 20. Life's just great right now, especially now that I'm feeling better and better.
I love it.
I have diagnoses of POTS, Sjogren's, mixed connective tissue disease, hypothyroidism, lots of mystery symptoms that are improving daily.
And PCOS in the past.
Yes, PCOS.
Yeah. Okay. So a lot of diagnosis. What people don't realize, Amy, and you realize now, is that people don't just have one autoimmune disease. Once you have one autoimmune disease, whether it's Sjogren's, lupus, or mixed connective tissue disorder, your body's already mistaking one part of your body as a germ, and it's likely attacking many other parts. And so I think that's the biggest. I mean, you work in healthcare. Can you tell people what kind of work you've done in healthcare?
Yeah, for the past 5 years, I worked as a director of nursing for a home health company here in Oklahoma. I did have to resign recently due to my health. As I was starting your program, realized that the stress from my job was making me very, very sick. So the mindset part of the program helped me realize that I needed to de-stress my life so that I could take care of me and get better. So unfortunately, I had to resign from my job, but hopefully I'll be able to go back to work soon. But I'm going to look for a less stressful job in the nursing field.
What I like about that is once you do get your health back, and yes, people do get their health back, I like to say that you can then exercise discernment and choice about how you want to work.
The main thing that made me realize I had to quit my job is my memory. I lost my memory at work. I would be repeating the same thing to my nurses every 10 minutes about a patient. And in my position as a director of nursing, you can't be like that, because I mean, I had my patients and my employees that I had to take care of, and it just wasn't working.
Well, let's go through symptoms, because I mean, when you look at lupus, Sjogren's, mixed connective tissue disorder, PCOS, hypothyroidism, how many years or decades would you say you've had these symptoms for?
Oh, at least 20 years. That whenever my first son was born at 22 is when it all went downhill.
Me too.
22 years ago.
I was 23. And I won't tell you how many years ago that is. Now you recognize when you delivered your first son, and that you delivered not just a baby, but the placenta. When you deliver that placenta, there's a huge hormone drop. Boom. That triggers the onset of autoimmune disease for tons of women. And for me as well. I developed postpartum depression and Hashimoto's at that time. Nobody even tested my thyroid. Nobody even knew anything had to do with autoimmune disease at that point. So you felt like that was like a time marker. Like I delivered my son and boom, my health started to go down.
Absolutely.
Okay. Prior to joining this program, like let's say 3 months ago, give me your top several symptoms as a result of all these autoimmune issues.
Brain fog for sure. I couldn't function. Pain, muscle pain from the mixed connective tissue disease.
Right.
Oh, stomach issues, diarrhea and constipation continuously. Just
like
one of the other. Yeah.
Yeah.
Bloating, all that, nausea, vomiting.
And lady, a lot of people look at like lupus, Sjogren's, mixed connective, POTS, hypothyroidism, or PCOS, and they're like, that gut problem ain't related to your autoimmunity. I'm sure you've had doctors tell you that.
Oh yeah.
What do you think about that now with the IBS?
Oh, 100% autoimmune, because it's
hell yes. 100%. We'll talk more about that. So number 1, brain fog. Number 2, pain. Number 3, diarrhea, constipation alternating, which is IBS. How did the POTS impact upon you?
Before I started the program, whenever I stood up, every single time I stood up, I would go into a POTS episode.
Which means your heart rate grows super fast. You could get faint, dizzy.
Yes, and then I couldn't even carry on a conversation. My words would just leave me. I figured out finally that I could sit down and put my feet up in the air in my office and my mind would come back to me. But you look crazy sitting in your office with your feet up in the air.
Or lazy, either crazy or lazy.
Right. And my job, I would have to get up and go to patients' homes, go into their homes still and see them, even though I was director of nursing. And by the time I would walk from my car to their house, I was in a full-blown POTS episode, and then I had to treat them. So it was scary.
It is scary, and yet traditional conventional medicine has no good answers for POTS. What were you treated with? How many doctors did you see for the POTS?
I couldn't even get a complete diagnosis of the POTS symptoms. Every time I would go to a doctor, they'd be like, well, that's really not my area. You need to go to this other doctor. And then I would get, like, for the mixed connective tissue disease, the dermatologist told me, she said, well, I could diagnose you with it, but what good would that do? So basically, she's like, there's no treatment. So
a lot. I want to know from the audience who's watching, how many people with low thyroid knows that 90% of you are walking around with an autoimmune hypothyroid, but yet your doctor won't test you for it or told you it doesn't make a difference because who cares if it's different? We don't treat it differently, but it's not true. So let's talk about that, because she's saying there's no treatment. Is it true that there is no treatment for mixed connective tissue disorder or a bunch of your autoimmune symptoms?
No, absolutely not. You treat the underlying autoimmune disease and it takes care of all of your symptoms throughout your whole body.
I mean, that's why to me, the 5 pillars and the 5 pillars protocol of Transform is really big. It's like, I'm teaching you, Amy, like, what is the root cause? And when you know what the root cause is, you stop that cause. Can every target of the autoimmune attack improve? And are they not all linked?
100%.
100%, right? So let's go into some of these symptoms. As far as brain fog, what level is 0 to 10? 10 was the worst. Well, you said the brain fog was so bad, you couldn't function at your work, you were being repetitive. So 10 being the worst, 0 being no problem. What number was your brain fog?
At least a 9.
Okay, what about the pain?
Pain ran around a 7 continuously.
What about the IBS, irritable bowel syndrome?
Oh, that was a 10.
Yeah, so you were planning your life around bathrooms and you're supposed to be driving to clients' homes.
Yes. Hey, let me tell you, out in the country, because I live out in the country, I'd be at a patient's house and there's no bathrooms around.
Oh, God.
So I would stop. I remember one time I stopped and went behind a hill to go to the restroom because my IBS was so bad.
See, that's the reality of what people with autoimmune disease have to deal with when they're dealing with gut symptoms that they're being told is not related to the autoimmunity at all. And you were planning your life and your career around bathrooms and around the lack of bathrooms.
Yeah.
Okay. That's terrible. All right. What about the POTS?
POTS was at a 9.
Okay. I don't know how you worked, Amy.
It was hard. I would go home and hit the bed and stay in the bed until the next morning. Then I would get home on Friday and I would be in the bed. I would get up to go to church on Sunday, but that was the only time I would get up. And that was my life.
Well, let's talk about what was your experience with dealing with doctors with all these autoimmune diagnoses? How many doctors did you see? What have you tried? What were the results?
Well, I started seeing specialists when I was 14 because I started having ovarian cysts that I had to have removed at 14 and again at 22 so that I could get pregnant with my second child.
That's the only way that we can deal with hormonal imbalances. Let's do some surgical procedures, right?
I've been to almost every type of specialist there is, starting from that time until now. I'm 43 now.
You work in healthcare, so you know a lot of these people.
Yeah. It's just so frustrating and expensive. You go and you go and you go and they do tests and they do surgeries and they give you medicines and dangerous medicines. I'm on Plaquenil and I've been on it 7 years and that can make you go blind. No answers, no relief, just continuously getting sicker and sicker and sicker. And it's scary. And I was at the point where I was suicidal because there was no relief and it wasn't getting better. It was getting worse and worse. And I didn't know what to do.
I've been there and you know that.
Yeah.
And you know what's for me was more infuriating was I'm in healthcare. I'm the person people come to for these answers. And I, as a doctor, came down with, I mean, you and I have very similar diagnoses, girl, with all these mystery symptoms, multiple diagnoses, no answers, yet I'm the one people are supposed to come to for answers, right? I mean, that's even more frustrating. And my colleagues were the ones that were telling me, hey, you're just getting older, or it's in your head. You need to get an antidepressant. What's wrong with you kind of thing, so it's reinforced as if we're crazy or lazy over and over again. Where are you now? Let's go through these symptoms. Brain fog was a 9 3 months ago. Where are you at today?
About a 1.
Seriously?
Yeah, every once in a while I have a little memory lapse, but my mind's back. For the first time in years, I feel like I have full access to my brain.
Wow. Did you expect that? Was that even one of the outcomes you wanted or you thought was possible?
No, I had no idea that it could get that much better. I thought I was going crazy. I mean, you think Alzheimer's, dementia, and I'm just 43 years old, and that's super scary.
What was the real reason? What did you discover was the real reason for this brain fog? Why you had such a big turnaround?
I went gluten-free, and 1 week later, my brain fog cleared.
Yeah, exactly. Food makes a huge difference. And for you, gluten made a huge difference. People don't realize there are specific foods for each individual that can trigger a lot of these autoimmune symptoms. So within 1 week, over a decade and a career ending level of brain fog was gone from a 9 to a 1.
Yep.
Okay. I can't make this stuff up, people. And then number 2, pain level. You said was a 7. Where are you at today?
Well, I'm still working on a gut infection, so I'm still dealing with quite a bit of the pain. I'd say it's hanging out around a 3 now, though, so it's much better.
So 7 to a 3 in just a matter of the last 2 months. And remember, I tell people the program is a launch pad. It's a 2-month online program working with me, and it's a launch pad to a year of autoimmune turnaround. So it's not like 7 and then the next day your pain is 0. It's like, depending on what the root cause is, there's a stepwise down approach to the pain as these issues resolve. So currently level 3. What do you think was the biggest linchpin? What did it to decrease it from a level 7 to a 3?
The gluten helped because it helped decrease some of the inflammation, but also blood sugar control.
I'm going to ask you, were you one of those people that was like, my blood sugar is fine. I know everything there's to know about blood sugar. I'm an RN. I know this.
Oh yeah. Yeah. I was like, oh, I'm good. My blood sugar is good. I knew I had dips every once in a while. I would have low sugars because I would start shaking really bad. But no, I was wrong.
What were your blood sugars really like?
Shitty.
You're taking my word. I'm a fan.
I know.
I'm a fan of the cursey words. Shitty. Well, what made you really realize how shitty it was? Was there a cause and effect? Was there a moment of aha for you where you're like, oh my God, this blood sugar thing really has legs. It is responsible for the brain fog and the pain.
Yeah, a couple weeks into the program, I realized whenever I wouldn't eat on time, I would go past my 3 hours. I would start having more brain fog symptoms. I would start having memory lapses, couldn't focus. And so I realized, oh, this is my blood sugar. I need to go eat. And immediately it would start lifting and I would get my mind back. So a lot of that was blood sugar related.
Well, and the thing is, people don't realize, like for me, I didn't realize why my pain was always worse late afternoon and early evening. Blood sugar. Like, I don't know if you noticed that, but certain times when my blood sugars were really dipping, my pain was worse. I don't know if you've noticed a correlation for you.
Yeah. It feels like I stiffen up whenever my blood sugars are not controlled well. If I don't control it well for a couple days and just kind of go off of my schedule a little bit,
yeah,
then the pain and the stiffness gets much worse.
Hell yeah. And then you mentioned that IBS level 10. Where is your IBS today?
It's about a 2. I'm still having a little bit of issues, but it's so much better.
Well, because you're also your infection load has been going down throughout the program. When the infection in your body is going down, there is something that we call die-off. That is a process where you can have little flares. But from a 10 to a 2 over the past 2 months, what do you think was the biggest culprit now looking back as to the IBS?
Oh, it's definitely gut related. I'm pretty sure I have a huge imbalance of my good bacteria and my bad bacteria.
Yeah, bacterial dysbiosis. And you know what? One of the most underlying causes of bacteria imbalance between the good and bad, number 1, poor digestion, right? What have you learned about your digestion in the last 2 months?
I wasn't making enough stomach acid.
It's shitty.
Yeah. So since I've been replacing my stomach acid and taking the digestive with the digestive enzymes, it's made a huge difference in my life.
Yeah. And I really encourage everybody when they start the program to start digest it as they're learning the program, because there's so many layers of education underneath it. But the first actionable thing is, well, yeah, get the water hydration 10-day water challenge in. And that helps digestion, by the way. And then the other thing is start your digestive, 1 with small meals, 2 with big meals. What did you notice right away when you started the digestive?
my poop started getting normal. That was the first thing I noticed.
That's really technical. That's that, Amy. The RN saying my poop started getting normal.
Oh yeah, that sounds real medical sounding, don't
I
it?
know.
I had got to where it was constant diarrhea the past year. Throughout my whole life, it was a mix of constipation, diarrhea, but the past year it had been diarrhea.
Right.
And within a week of using Digest It and being off of the gluten, my stools started becoming firmer.
Farmer
They were,
stools.
they didn't smell as bad.
Didn't smell as bad.
I wasn't passing gas
Not
near as
passing
much,
gas.
and the stomach pain was greatly decreased.
Greatly decreased stomach pain. And this is just from learning about how shitty digestion is for people with autoimmune disease and starting Digest It. So what about food mapping for you? Was that a big game changer or was it not a big game changer? Because people come in will assume like, oh my God, it's all in the food mapping or it's all in the hormones, it's all in the labs. And everybody discovers that they have personalized results and everybody has different root causes to different degrees. How was food mapping for you?
It was negative, 100% negative.
Right. So
Everything.
my question for you is, knowing that it was none of those other foods, how crucial was that to your turnaround?
Well, I just assumed it was going to be a lot. I figured I would have a lot because most people in the program at least have one or two. But then when mine come back 9, I was like, you had prepared me because I heard you telling people, don't be upset if it's not that, because that's just more information, more data you get. So
well, yeah,
because
you know what I've said what it's not is just as important as what it is. Because when you find something what it's not, it brings you closer and closer to the truth. Because how great is it that Amy didn't have to pull any other foods except the gluten, and the real culprit is not eliminating more and more foods. It's not the food, it's her blood sugar and her digestion. Who would have guessed that with IBS?
Dr. Maggie knows.
Because so many people, that's actually what happens. So I think it's really important to understand that negative and positive results, I treat the same way. They're both opportunities and they both bring you closer and closer to the truth. All right. So pot symptoms was a 9. Where are you at now?
I'd say a 2 because I'm having 2 or 3 episodes a week now.
Versus?
Daily, probably 30 a day.
Whoa.
It was literally every time I stood.
30 episodes a day for years. And in the last 2 months, she's down to 2 to 3 episodes a week.
Yeah.
That's huge. And POTS is a problem that people in the conventional medical community says has no treatment. There's nothing they can do. What do you think of that statement?
There is something you can do.
You know what I think? Utter BS. You know why doctors will say sometimes there's nothing they can do about it? There's no script they can write to send you out on your way. There you go. Out of my way. If there's no script to do that, they're going to be like, you don't have that problem. You're crazy or lazy, or there's no cure for that. There's nothing you can do about it. And none of it is true. You're not crazy. You're not lazy. And there absolutely is a ton you can do about it, but it's not a script they can write and send you on your way. Does that make sense?
Yeah.
Okay. So let's talk about it. When you first learned about this program, how long did it take you to decide that this was something that you wanted to learn more about and you were serious about it?
So I discovered your program through Facebook. I had been searching for groups to help with autoimmune, with POTS specifically, because at the moment that was my biggest issue, the POTS and the brain fog.
Right.
And once I discovered your program, I was like, wow, this lady is onto something, because it all made sense. Because I've always taught my patients the why of why I'm teaching them something. Right. Because if you know the why, you're going to be more prone to stay with it and stick with it. And you know what's going to happen if you don't. So soon as I saw it, I started talking to my husband, and within 2 days, I had already made the decision to go with the program. And within 1 week, I was already started on the program.
That's so cool. So if there was something that was holding you back from joining, what would it have been?
Probably money.
Okay. Tell me about that. What was that money?
Well, I thought about it at first. I was like, man, it's a lot of money to have to do this. And I'm not sure if the program exactly would work. I was pretty sure it would. And my husband, he was like, if you think it'll work, do it. But then I got to thinking about this year alone, I had already spent $5,000 and had no answers with my doctors because I'd already had a brain angiogram this year and no results, no answers.
You didn't need the brain angiogram, lady.
No, I didn't need the invasive procedure that cost me thousands of dollars. So once I thought about that, how much I had spent just this year alone, plus all the thousands of dollars I've spent through the years, it was just a no-brainer. I had to try it. And I'm so thankful that I did because it has changed my life dramatically.
What do you say to somebody who says, you know what, it's too expensive? What do you say to that person? Because you were there just 3 months ago.
You can't afford not to do it because your health is worth more than any money. But if you don't take care of your health and your autoimmune right now, it's going to continue to get worse and worse and worse. So you've got to do it.
What's one or two of your favorite things about being in the program?
One that was completely blindsided me, I wasn't expecting, was the mindset work.
Yeah. Let's talk about that. Mindset work. You're a medical worker. What do you mean mindset work?
The mindset work is huge. It helps you evaluate yourself, find the worth in yourself, and start living for yourself.
But that's the thing, Amy, is a lot of people dealing with chronic sickness of one type or another start to lose faith and trust in themselves, and they don't value their own self-worth.
Yeah, I was there.
Well, if you're suicidal and I have been suicidal, we both were there. And if you and I went there, I'm sure many people in the audience went there, right? So tell me one piece of mindset work that was for you, like a surprise or aha or something that you like even implement on a daily basis. What was one mindset work that you thought was like, whoa, that was really surprisingly crucial?
Boundary setting. So I was a person who wanted to please everybody. I never could say no to anybody about anything. I would work myself to death just so I could help everybody or make somebody's life a little bit easier. And I realized I had to set some boundaries because that's not logical to do that. You can't do everything for everybody all the time. So I started setting my boundaries and taking care of me.
I find that when people are boundaryless and they're pleasers, what they do is they actually end up doing a lot and they end up building a lot of resentment in themselves. And resentment really just harms you because living in the energy of just resentment, whether it's not directed towards other people or yourself, feeds autoimmune disease and sickness. And they don't realize that. You know, because when you resent whether someone else or yourself, you're self-harming yourself. So yeah, I love that boundary setting. I love it. How do you think your relationships have changed as a result of the work that you've done in this program?
Well, boundaries are one of the things I have worked on in my relationship, especially with my sons and my husband. We've always all had really good relationships, but the communication wasn't there. And sometimes they would say something that would upset me. And instead of me telling them what it did to me, I would just internalize it and run away and be sad myself. But now since I've learned the boundaries, whenever they're saying something and I start feeling that build up in my chest of anxiety, I stop them and I say, I don't know how you're meaning what you're saying, but whatever you just said and how you said it makes me feel bad. So can we talk about this and figure a different way out to talk?
How's they responding to that?
Oh, they've done wonderful with it. At first they were upset, but once they realized, and I told them, I said, look, this is not me trying to tell y'all what to do or what not to do. This is me trying to make myself healthy and feel better. And this is what I need. So they've been wonderful. They've really been trying.
At first they thought you were blaming them.
Yes.
And then they realized it's not about me. It's about mom getting better. And how can I support her?
They're all getting on board too. They're working on their health now. All three.
Tell me about that. How have they been working on their health?
So they all let me get them tested. We went and got their blood testing. And so
great. Because you learned not just to test your own blood, you learned how to look at their blood work critically.
Yes.
Yeah.
And all three of them had low numbers. And so they started their supplements immediately. My husband got his hormone results back and he was he's in stage 4 adrenal fatigue. He's not making any cortisol and his testosterone is bottomed out.
There are reasons that he was getting more tired, more irritable, or less tolerant.
Yeah.
Yeah.
And that's also helped me understand him better too, because now I know, well, he's in hormone hell too. So he's right there with me, but he's on his supplements and he's working on it. My boys, they have their hormone test. They haven't sent them off yet, but
wow. You're Amy, I mean, you're seriously killing Godzilla while he's an egg in your children. And you're also taking this seriously. Like I tell people, well, My mission in this program is that you're the pilot and no longer the passenger in your health. And here's the deal. When you're the pilot, guess who else could be on that plane? Your family, your husband, your kids, right? So for me, you're not just piloting your own plane, you're piloting the family's plane. I love that.
I'm excited. We're all going to be healthier around here and we can go do more fun things together.
I can't wait for your husband to start to feel better. I know that you just started him on a couple things and his labs and his hormones, but I would love to do an interview with the follow-up with the mister. And you like 1 month later, here they are. I'd love to see how he turns it around. That's awesome. All right. So Amy, what's something that you can do now today effortlessly that 2 months ago you would have thought was impossible?
Oh man, 2 months ago, it was tiring for me to walk across the room, but I've been working on my house because when you don't feel good for a very long time, your house kind of gets a back seat. So my house needs a lot of spring cleaning. So I've been working on that and that's making me feel so much better, just getting the house back in order.
I want to see some of those progress photos in the den. Will you do that?
I sure can.
I want to see it. That's awesome. Well, Amy, thank you so much for sharing your journey today. And is there any final message you have for anyone watching? I mean, because I know we're talking about you dealing with lupus, Sjogren's, mixed connective tissue disorder, POTS, hypothyroidism, irritable bowel syndrome, just to name a few. And these symptoms are like 7, 8, or 9 level. And all of those are like less than 3 right now, just 2 months later, and on the way to becoming even less. Is there any one last message that you have for anybody out there who's watching, who's suffering from any of these symptoms?
You don't have to suffer with it anymore. You're not alone. You don't have to fight your doctors. You don't have to pay thousands and thousands and thousands to doctors with no results. All you have to do is say yes to Dr. Maggie and jump on board with all of us and do this program. It's amazing. The 5 pillars teach you how to take care of yourself and your family for the rest of your life. You don't have to rely on Dr. Maggie after you get out of the program. You know how to take care of yourself. So you have to do it.
I'm hurt you say you don't have to rely on me for the rest of your life.
I love you, Dr. Maggie, but you give us the tools to take care of ourselves.
I know. I tell people that. Remember, like you see me on the mastermind calls where I'm like, hey, the reason I'm asking you guys these questions, the reason I'm troubleshooting with you, the reason I'm asking you to repeat this or to come up with these answers is why? I'm creating a model of independency. I'm not creating a model where you're dependent on me. And if I do my job right, which I always do at the end of this, you have independence, not just from me, but from all the other doctors or fools. No way. You're the pilot. You're not the passenger anymore.
And that's what I love about this program. I now know what to do for me and my family for the rest of our life. I'm confident in it now.
Congratulations.
Thank you.
I want to thank Amy for sharing such a personal journey with her victory around POTS, Sjogren's, lupus, mixed connective tissue disorder, and hypothyroidism. Who knew digestion, hydration, gluten, and blood sugar has so much to do with turning around these impossible to treat diagnoses and symptoms? It is so gratifying for me to see someone who has symptom level of like 7, 8, 9, or 10s, who literally couldn't do her job anymore, directing other nurses or traveling to clients' homes, be able to get to a point where her symptoms are like 0, 1, 2, 3 level compared to 7 to 10 level over just a period of 2 months. If you yourself are suffering from any of these diagnoses or symptoms, or if you know somebody, do you know somebody who's suffering from those, put their name in the comment section below, because I'm going to ask you a favor. I want you to share this and raise awareness around autoimmune disease. Will you do that? Tag somebody that you know who could benefit from this video in the comment section below. If you yourself need to be helped, just comment in the comment section, tell me more about what's going on with you. And then make sure you check your Facebook Messenger requests for some messages from our team so we can direct you to the right case studies and resources to turn around your autoimmunity. And if you haven't joined our Facebook group, make sure you click the link and join our Facebook group. It's called Transform Autoimmune Disease Naturally, one of the biggest Facebook groups on the planet around turning around autoimmune disease naturally. Thanks, everybody.